Hi, I'm Dr. Terra, and welcome to Smile the Show. In today's show, we have different topics like health, fitness, and beauty. Welcome to Smile the Show. We have with us today Trey Brabag, who is a personal trainer from the American Council on Exercise. Welcome to the show, Trey.
Thanks, Julio. It's a pleasure to be here.
So, Trey, tell us, what are we going to talk about today?
Well, today we're going to talk about the less obvious effects exercise has on your life. Everyone knows about the effects that exercise can do for you in regards to obesity, diabetes, and other types of diseases, but today I want to talk about the less obvious ones. Things like mood, sleep, your job performance, and even your sex life.
That's really good. So how do we start?
Well, we're going to start first off with sleep.
Why we don't jump to the fourth one?
Well, I know everyone wants to go to the sex life, how it can affect your sex life, but we're going to go through each one first.
Okay.
For example, there's an interesting study from Harvard that talks about exercising just 3 times a week and how it can positively affect symptoms of depression.
Oh, that's good. That means that the hormonal changes and also chemical balance has to do something with that.
Exactly. Exercise actually has an effect on your brain in regards to endorphins and dopamine.
That's great. So you rest better and you perform better.
Exactly. That directly affects your job performance.
Okay, good. So what is the second part?
The next step is we're actually going to talk about sex life.
Okay,
So,
perfect.
there's actually a University of Texas at Austin study that shows that the flow of blood for women after exercise actually increases their pleasure for sex.
Okay, and what about men?
Well, actually, obesity is linked to erectile dysfunction, and exercise can help the guys out too.
Wow.
So.
Okay, guys, we need to go to the gym.
Yeah.
So how do we start this?
That's a good question. Getting started, there's some tips to think about when getting started, and number one is to actually pick a date. Instead of talking about things you want to do, like, oh, I want to start surfing or I want to start working out, we want to take it from vague things to talk about, vague desires, and actually make it concrete. So
Make it happen.
Make it happen.
Okay.
Actually picking a date, putting it on your calendar as something you're going to do, like it's a doctor's appointment or some very important
Dental
event,
appointment.
A dental
Yes.
appointment, exactly. Something that's very important in your life. You want to actually pick a date and you want to write it down. Writing things down is really important because, again, it makes things more concrete rather than abstract ideas.
Okay, Trey, we know how to start and everything, but how we get that push to continue doing the exercises?
Well, one important thing is to identify a support system around you. It could be a spouse, it could be a lover, a family member, or even a coworker that maybe wants to start working out with you at the gym. But the key is to identify people that are supportive around you, that when you bounce, your plan, bounce some ideas off them, share, what your plan is with them, that they're really supportive, and identify with those people, and those are the people you want to share it with.
I think we need someone who has good energy to push you and do better.
Absolutely, absolutely. You want to gravitate towards those people and share it with those people.
Okay, good. So we know already we need to have the plan, have someone to help us, like a support group. So what's next?
Well, once we've actually started the plan, the more challenging thing is actually staying on a plan. A lot of people are able to start, in January, work out for a month, and start something for a few weeks, but staying on a plan is really challenging. And there's some things to think about when you're on a plan, so some pointers as well that will help you keep going.
Okay. In these days, social media and all the apps, there is something to help us to keep on track with our exercises. Do you know anything about that?
Yeah, there's lots of different apps available that help you. Things like MyFitnessPal or Lose It, where you can count calories and whatnot. But really, when it comes to an exercise plan, it's good, again, to write things down, and it's good to have an actual plan. And it's good, really important to separate your long-term goals with your short-term goals. Say, for example, that you have weight loss as one of your goals. That's a challenging one, and a lot of people have that. But it's good to think about if you say you have 30 pounds to lose, you want to separate that as your long-term goal and separate that from your monthly goals. So
Okay, it's like a making realistic expectations and feel those.
Absolutely.
Like you are going to lose this, but you have this time to do it.
Absolutely.
Okay, perfect.
Now, these realistic goals could be kind of skewed from what's going on right now, what you see on TV with how many dramatic shows where people are losing
Yes.
vast, like 5 pounds a week, 10 pounds a week.
Okay, how that happens?
Okay.
They go to these shows and they lost a ton of pounds in just a couple of days.
Well, they're on a show and they're not doing their everyday. They're not going to work. They're just
don't
shooting
work.
they're just shooting a show and they're just spending their whole day losing weight. So it's really easy for them to lose these crazy amounts of weight. But in real terms, we want to set some goals that are realistic, and 1 to 2 pounds of weight loss each week is more realistic. And it's good to separate your goals into monthly goals and think about your long-term goals, but separate it into a month. Where if you want to lose, 4 to 8 pounds in 1 month, that's a realistic goal.
Trey, I had this question. What happens if you say, okay, my goals are 5 pounds, but you just lose 3 pounds? You will be disappointed.
Well, that's where you would wrap up each month and take a look at what happened in the last month. And say you wanted to lose 6 pounds this month and you only lost 3. Still, you've lost 3 pounds and you've gone towards your long-term goal. And it's good to identify maybe what was challenging, what you could do better maybe next month, but you still had a success. You had a victory this month and you moved towards your goals.
So in other words, what we have to do is, first of all, have like a real expectations, stick to the plan, have positive energy, and hey, give yourselves a pat on the back because you did something good.
Absolutely, absolutely. The whole thing is identifying what went really well and moving forward.
Trey, thank you for being with us. For more information about the topics we talked today, please visit the website below. And thank you for being with us, and stay tuned. We'll be right back. Welcome back to Smile the Show. Today on our beauty segment, we have Manny Paez, who is a hairstylist from here in Long Beach, California. And Manny has 11 years of experience. Thank you for being with us, Manny.
Thanks for having me, Dr. Terra.
Okay, Manny, tell me. In these days, hair extensions is a big trend. So help us to understand what is that and how to take care and all the things that everybody wants to know.
Okay, well, hair extensions, it's really not for everybody. So there's 5 different ways you can actually find out if the right person is candidate for extensions. And the maintenance, as far as maintenance and if your texture of the hair. So,
Okay. So people who have lost hair problems and people who have been under chemotherapy and all those issues are good candidates for hair extensions?
they can be actually. The first thing you got to ask the clients is they have to get a clearance with their personal physicians. If they said they have the clearance and they said they can go ahead. So what you need to do is you evaluate the texture of the hair, how much growth they have. So it's definitely beneficial for them. Or there's also another alternative that can do they can do wigs.
Okay, there is something like, okay, we know that they have to ask the doctor if it's okay to use extensions or something. What happened with the kind of hair that they use? Is that good for the immunology system of people who have been treated with for cancer?
There's a store that actually made hair or wigs for clients or patients that who recently had a chemotherapy or just had a treatment and their hair is starting to grow back. So there's a lot of ways that they can find out. They can go either they can ask their hairstylist or they can go online, and there's a lot of stores or wig company that actually makes those hair for them.
Something that is important also, what happened with the hair is synthetic against the natural hair, which is the best way also. From the doctor's point of view, I will think more about the health of this patient and, of course, the beauty.
Exactly. So, because a lot of the patients who recently just had a treatment, you really want to protect their immune system. So that's the main goal. They can go synthetic, and they can also go 100% human hair, or synthetic with mixed with human hair, just depending on what their choice is.
We're talking about when you look good, you feel good.
Exactly.
Okay, so that's the part related to hair. What about makeup when you have been treated for cancer? Which is the way to go to make it easier and healthier for these patients and also to make them look good?
With makeup, there's a lot of company out there that actually make or create makeup for people who just got a treatment. So you really want to be careful, selecting makeup, because the immune system, and also just finding the right ingredients. You want to look at the ingredients. You want to make sure that you're using the natural and less synthetic ingredients. It's going to make a difference for patients who just undergone treatments.
So that's what they call minerals?
Mineral makeup, it's really good for them. And there's a few companies that's actually created a makeup just for people who, patients who just had a treatment. And brushes is very important also, because you want to make sure when you're using makeup brushes, they're not using like a regular brush.
Yeah.
Those are very important because, again, it's the immune system.
I saw one study that said that the amount of bacteria that you find in women's makeup brushes or makeup in general have more bacteria than even, sorry to say this, even a toilet.
Exactly.
So people who had the immunology system suppressed because the treatment, I think it's more important to have brand new and really clean and avoid something that can produce damage.
I mean, as a professional, I suggest that when they use the makeup, they want to use the brush that's disposable.
Okay, so so far we know that regarding to hair extensions are good. I mean, I think I need some. So go with natural hair or synthetic hair. Be sure that it's clean, that it's nothing that is going to produce damage.
That's the most important thing. It's definitely sanitation and the patient's safety.
So we go for something that is called minerals. Avoid dirty makeup. Try to get a brand new one or at least clean one. Disposable brushes or synthetic brushes. Other thing that I hear is don't use animal hair products because that can produce damage also to the immunology system.
Exactly. So they want to make sure that they're not using like a mink brush. Instead of mink brush, I normally recommended synthetic brush.
Okay, Manny, I think you help us a lot with information today. And again, for more information about the topics we tried today, please visit the website below. In today's health segment, we are going to talk about difference between metal braces and clear braces. For this topic, we asked people on the streets what they prefer, metal or clear.
Yeah, I like invisible because that's what I'm wearing right now. It seems to work for me.
I prefer invisible.
I prefer invisible braces.
I prefer clear, no metal.
Invisible braces.
Invisible, mil veces invisible.
Invisible, definitely the invisible worked for me. It fit my lifestyle well, the ability to easily put them in and out, to wear throughout my workday, as a professional in a management position. It just seemed to make more sense for me to be able to continue to wear them throughout my day, but still not be a manager in metal braces.
Well, that's clear what people think about metal braces against almost invisible braces. Do you know that 74% of the Americans suffer of any kind of malocclusion? Malocclusion is malposition of your teeth, or what we call crooked teeth. Crooked teeth produce some problems like periodontal disease, premature wear down of the teeth, also something as important as heart disease. I'm going to talk a little more about heart disease. People don't know the correlation between heart disease and periodontal problems. all those bacteria that we have in our mouth can go through our blood system and reach our heart, giving high incidence for strokes. Okay, now we are going to talk about malocclusion. Malocclusion produces also different problems like chipped teeth, fractures. Again, we go for TMJ problems and headaches. I'm going to talk a little more about the chipped teeth. Normally, we get information from a dentist, you are brushing too hard. For that reason, the gum level of your teeth are so exposed and you have some sensitivity. Not always. Sometimes what happens is we are biting so hard that the area around the gum level of your teeth get broken. Is when we have all that sensitivity and the space between our teeth and the gums. So remember, malocclusion can produce the problems, not just because you are brushing so hard. One other part that is important for us is the TMJ. Is one of the major concerns in these days. We talk about TMJ problems, headaches, bad mood. All those things are related to something as simple as malocclusion of your teeth. I always explain to my patients, whatever happened on your hips reflects on your knees. The same in your mouth. Whatever happened on your teeth reflects on your TMJ. So it's something for us to take care and avoid major problems. So this takes us to the healthy teeth. Healthy teeth help us a lot. That way, if we take care of those malocclusions and malpositions, we can avoid major economical expenses with dentists. We avoid to have more dental treatment, and also we can have a better looking healthy teeth. So for me, more than regular braces or metal braces, I prefer to use with my patients what is clear or almost invisible braces. And why? Because that helps us to have a better, easy way to clean our teeth. We can have a better looking smile. We don't have all the metal in our mouth that doesn't look that good, and we want to look good. So in conclusion, invisible braces or almost invisible braces is the way to go. And remember, smile, we do the rest.